Good morning, good afternoon, good evening, wherever you are, and welcome to this TechNet 21 webinar on using PATH's vaccine cost calculators to inform immunization decision-making. Today, we're welcoming Frédéric Debellut from PATH. Frédéric is a senior health economist at PATH's Center for Vaccine Innovation and Access. He's responsible for the design and conduct of economic analysis with the objective to generate and translate economic evidence that informs donor investments, global policy, and country vaccine introduction decisions. His work encompasses cost of delivery and cost effectiveness studies, budget impact analysis, and demand forecasting, and focuses on vaccines against rotavirus, typhoid, HPV, meningitis A, and seasonal influenza. Frédéric will introduce you to the PATH vaccine cost calculators, and during his presentation, you'll be able to ask your questions in the chat box or, preferably, the question and answer area. Your questions will be answered after the presentation. This webinar will last 1 hour and is recorded. We'll share the video as well as the presentation by email and on the TechNet platform. Finally, this webinar is offered by PATH and TechNet 21 in partnership with the East African Community, managed by the East African Community Regional Center of Excellence, as well as the Vaccine Procurement Practitioners Network, managed by UNICEF Supply Division. If you'd like to be in touch with one of them, please contact me. You should have my email address in the invitation you received after registering for the webinar. Frédéric, the floor is yours.
Thank you, Alex, and good morning, good afternoon, and good evening to everyone. Very happy to have this opportunity to present you the tools that have been developed and released now a few months ago. I have only a few set of slides that I'm going to use to share some background information, some rationale for how those tools were developed, and then we'll move to an orientation of the calculators, which I'm going to do hands-on here on the screen. And as Alex was saying, towards the end of the session, I'm more than happy to get comments or answer questions from the group. So with this, I'm going to get started with some background information. I'm going to start with some background information, and I want to highlight here that there are many considerations that comes with decisions around introducing or using new vaccines. And I've laid out some of them here on the slide. When thinking about introducing new vaccines, decision makers would assess if the vaccine is needed in their context, what kind of benefits the vaccine would bring, if they have enough capacity in their cold chain system to accommodate or store it, and also what will it cost, and can we afford it? And this last piece is really the focus of the cost calculators. In addition to the many new vaccines or antigens that are available to countries, we also see an increase in new vaccine products and new formulations of existing vaccines that continue to be developed and commercialized. So not only countries now have to decide which new vaccine to introduce among several antigens, but they also have to think through which product they would select. As an example, 2 new rotavirus vaccines, namely Rotavac and Rotacil, enter the global market in 2018, which expanded the market, which for a long time was dominated by a single product, Rotarix. Similarly, for the PCV market, Pneumocil, a new pneumococcal conjugate vaccine, became available in late 2019. And these products have a diversity of characteristics. You can see at the bottom of the slides the different rotavirus vaccines. They differ in terms of the number of doses in the schedule. Some are 3-dose vaccines. Rotarix is a 2-dose vaccine. They also have different delivery devices They have different prices, obviously. They have potential different wastage rates, different presentation, different dose per vial, etc. And so all of those characteristics, they may have implications in terms of cost for the vaccination program. And so while we often see that a diverse market is obviously beneficial in terms of supply, in terms of innovation, and for affordability through higher competition, usually driving prices down, but it also makes decisions more complex for country decision makers. And when they're thinking of choosing which vaccine product to introduce or to switch to, as we recently seen countries moving from one product to another. Because of this complexity, there has been a call from countries and from partners such as Gavi to have new tools to help with those decisions. And that's what we try to respond to by creating the vaccine cost calculators. So here I want to highlight the note first on this slide and repeat that cost is really only one of the many considerations in for decision making. But we do think that's an important one because all immunization programs face a challenge of sustainability, financial sustainability at one time or another. So the vaccine cost calculators are meant to help with minimizing the cost of your program by selecting the right product, which in this case would be the least costly product for your context. And so optimizing the cost of one particular vaccine program could potentially free up resources for another, therefore ensuring a careful comparison of costs before selecting the best vaccine option for introduction or switch should be a critical factor in country decision making. And so how to move into how we develop those tools for a while already before we started starting developing those calculators, our team has been involved in developing cost estimates of vaccine and vaccination program costs for different countries to inform their decision making. That's a request that we were often getting when decision makers were looking at new vaccine. And so since we've done this already, we just thought that we would use the same methodology and just build and make available a streamlined, easy to use vaccine calculator for decision maker and country stakeholders that want to run their own analysis. So the PULSE vaccine cost calculators are simple, easy to use, Excel-based tools for assessing and comparing costs of specific vaccination programs. They are currently available for rotavirus and PCV vaccines due to the complexity of those vaccine markets. They allow for a rapid analysis of cost over a 10-year period with each vaccine product that are available in the global market. I'll say a bit more later, but we also are currently developing a similar calculator for HPV vaccines, and we are also in discussions for additional calculators for other antigens. The way it works, users input a limited set of local data into this pre-populated spreadsheet to compare and estimate vaccination program costs with different products. And they have the ability to explore several options at once. And I'll be showing you this. During the development of the calculators, we went through several iterations, and the tools have been reviewed by a range of colleagues and partners, and that includes members from Gavi, from the WHO, UNICEF, CDC, and also field partners like GSI, CHAI. We also asked the foundation to review the calculators. At PASS, we asked some of our country staff that are working on immunization to review and to provide feedback. And also CHAI also had their staff working in support to immunization program teams, review the calculators, and they provided a lot of useful suggestions for improvement. And so I'd like to thank all of those that participated in reviewing and improving the calculators before the release. So here are some of the features of the calculator. So they include vaccine costs, which encompass vaccine procurement, vaccine supplies, handling, and shipping. They also include vaccination program costs, which are composed of vaccine costs and additional expenditures that are required to deliver the vaccine, such as staff allowances, training, transportation, storage, etc. The calculators provide information on the cost to the country only, which would be the cost supported by a country budget, but also calculates the cost to country and to Gavi, which would be accounting for the financial subsidies and co-procurement from Gavi. All costs are calculated and available annually and for a period of 10 years. That's also defined by the user. As you will see shortly, the Excel spreadsheet is populated with default data and leveraged data from multiple sources. From Gavi, for example, for all product profile information and for the financial support data. From UNICEF for data around handling and shipping. We're also pulling out data from the immunization delivery cost catalog for cost of delivery data. We are also indicating additional links and resources online to the WHO for position papers or for some of the vaccine prices. Those default data, we have a plan to update them moving forward when it will be required. For example, if new products enter the market, or if we see or witness significant changes to prices, for example, or to other characteristics that should be reflected and updated in the calculators. So you can access the vaccine cost calculators online. You can use the links that are here on the slide. They're available in multiple languages, so you can access versions in English, French, Russian, and Spanish. As I was saying, there's a cost calculator for HPVs that we hope will be available over the course of the year. And the discussions we're having around additional calculators, we're having discussion about potentially having a similar calculator for maybe for COVID vaccines and typhoid fever, but that's still just under discussion, and there's nothing that's set yet. So with this short introduction, I'm gonna move to the calculators demonstration. So, and I'm gonna be showing you the calculator for PCV vaccine. So I hope everyone can see the Excel file on the screen, and that's basically what you would see when you open the cost calculator. You can see that it includes 4 different worksheets. So a README first tab with instructions on how to use the tool. There's a tab where user will enter model inputs. I get back to it shortly. There's a tab with results in the form of a table, and then there's a tab for results showing as charts. So going back to the instruction tab, here you can find a broad description of the tool, what it does and what it does not. We also provide a description of the different tabs that you can find so that users can orient themselves in the tool. We explain the process, the different steps that are required to enter data to run your first analysis, and I'm going to be walking you through this right away. You can also see that we are providing some links here, which are the source of information for the default data, but also just additional resources for users. So you have links to the Gavi websites. You have links to the WHO vaccine purchase database, position paper, some links to UNICEF website as well. You'll see that in the tool we always refer, and I kind of explained this during the introduction, but we always refer to vaccine cost on one hand and then vaccination program cost. So again, the vaccine cost, it's really about cost of vaccine procurement and other immunization supplies, plus international shipping and handling, while vaccination program cost would include vaccine cost and additional costs related to the immunization program, such as training, cold chain storage, vehicles, transportation, etc. And here we also provide an additional, another definition of what should be included in these additional expenditures. And finally, at the end of this instruction tab, we provide all the different calculations that are used in the tool. So for the sake of clarity and transparency, anyone can come here and check like what kind of formulas, calculations formulas we've been using to come up with our results. So now moving to the model inputs tab. So that's where a user will enter data. You can see that it's kind of pre-populated with data available from different sources. As a user, you would only have access to those yellow shaded cells. All the other cells are locked, and that's so that you don't break any links or any formula. So you really have to focus on those yellow shaded cells. And there are 3 different steps to enter data. So the first one is about information regarding your immunization program. So here you would, for example, enter the start year for your analysis. So that would be either the year where you're expecting to introduce a new vaccine or the year where you think you're going to be switching a product. And that's your start year for this 10-year analysis. You also enter information around the target population for the vaccine, an annual population growth rate that will be used to calculate follow-on year populations. And then you also enter expected coverage rates for your program for this particular vaccine. That can be based on existing coverage rates if you're looking at switching vaccines, or can be informed by other antigen in your program. The second step is about entering information regarding potential financial support you're receiving from Gavi. And so for Gavi countries, that's really where they can set up the support they're receiving. So you have a drop down here where you can select kind kind of which transition phase you're in regarding Gavi support, either initial self-financing or all the other transition phase. Here you can enter for every year the your country co-financing share. So that would be the share of the vaccine price that the country is supporting. And we are providing, so that's, I'm sorry, that's very small and probably you're not able to read, but we are providing here some indication on how to either make those calculations or who to reach out to if you're not sure about your co-financing share. You can also enter here potential support for Gavi vaccine introduction grant or Gavi switch grant if that applies. And we are providing on the right here a box with indication on how to calculate those grants. And we also provide the link to the Gavi support guidelines in case you have to confirm some of the assumptions around financial support. The step 3 is about the different vaccine options you want to analyze. So here you have, so you can compare up to 6 different vaccines. So here 6 different PCV vaccines. So you have drop-down menus where you can select among the different vaccines that are available on the market. And when you do this, you can see that some of the data down here are actually updating. Here I've done a quick analysis using 5 different options. There's a 6th option for PCV vaccines here, this Synflorix 10-valent 1-dose vial. But as you can see, that's not a product that's available to Gavi countries. So it's included in the cost calculator for non-Gavi countries would have interest to use this particular presentation. But there's a flag alerting that as if someone from Gavi country is doing an analysis, they might not be able to receive support for this presentation. So first, you would basically select the different vaccine options that you want to analyze. The price per dose and co-financing amount per dose would be would pre-populate based on your selection, and the co-financing amount per dose would calculate automatically based on what you indicated here in step 2. You have additional information that pre-populates, such as the number of doses in the schedule, and you have the cold chain volume per dose. Those are the information coming from the Gavi detailed product profile. Then you can enter wastage rates. We also provide an indication of wastage rate indicating on the detailed product profile, but you can modify that in case you think you can achieve better, or you may face higher coverage wastage rates. You can enter information on international handling, international transportation, the price for safety box, and the syringe price. And here, those are data pre-populated from the UNICEF website. Moving on to the vaccination program cost, here, this is where you can enter additional expenditures that are related to the planning or immunization program management, but also the cost to deliver the vaccines. So there are 2 ways you can use. You can either enter one-time introduction or switch cost lump sum that will be accounted for in the calculation for the first year, and you can indicate cost of delivery per dose. And for this, in case there's no information available for your country, you can check this link where all cost of delivery studies that have been published have been used to create a database where you can collect some useful data to inform this parameter. You would basically enter information for all of the options that you want to assess. And once you're done with entering data, you can directly move to the results spreadsheet or tab. and just check what kind of results you get for your analysis. So here on the results tab, you can see that we get our different vaccine options here. So there would be one kind of one column for each vaccines. The first part of results that we provide is around the data calculated for your immunization program, and basically the number of doses that would be delivered over a 10-year period or every year, and the total number of doses that are required, which would include the wastage. We also provide annual information on the total cold chain volume that's required for a particular product. And you can see that this would differ from one product to another based on their own volume. This is just an indication that might be helpful when you think about potential additional expenditures if you change vaccine or when you introduce a new vaccine. Moving down, you can find all the costs that have been calculated, starting with cost to country only. And a bit further down, you have the cost to country and to Gavi. So if I'm going back to the cost to country, you'll see that you have on one hand the vaccine cost, and then on the other hand, the vaccination program cost. Again, you have those information, this information for a total of 10 years or annually if you're interested in a shorter period of time. And then, so we're using, the calculators are using conditional formatting to highlight which of the option would be best or the least costly. And so here in our example, that would be Pneumocil 5-dose vial. Looks like it's the cheapest option. And that's obviously based on all the data we entered in our model input spreadsheet. There's no built-in sensitivity analysis add-on that's included in the calculators. But since the calculations are automatic, it's pretty easy to just go back to the model inputs and change some of your parameters, and then go back to the results, or to save different files so that you can have a more comprehensive analysis in case you have some parameters for which you feel there's some uncertainty that should be accounted for. So to finish, we have this charts tab that's basically displaying exactly the same results. Again, cost to country and to Gavi. We provide 10-year summary results and annual results. And basically, it's just the table we just saw that are presented here in the form of charts. So you can find again your the 5 different options for which we entered data in this analysis. And you can see that Pneumocil 10-valent is the cheapest one. So that's it for the tour, for the PCV tool. I'm quickly going to show you the rotavirus cost calculator. As you can see, this is very, very similar to the PCV cost calculator. Basically, this one was developed first, and we adapted it to have a PCV calculator. So there are very small differences here. I guess, well, obviously, the main one would be that instead of having PCV options in the drop-down menu, you have all the different rotavirus products and presentations available on the market. Another small difference is that here we removed the cost linked to syringes, because for now, all rotavirus vaccines are oral presentations. Yeah. So basically, quite quickly and with a minimum amount of data, you can run an analysis and get some results and compare different vaccine presentations to figure out which one would be the most interesting or least costly for your context. So I'm now at the end of the demonstration. I'm happy to hear comments or answer questions. There's just one last thing I'd like to say. Yeah, so that's this last slide. If you think that those calculators can be helpful to colleagues of you or to people in your network, I'm asking to please help us make sure that they know those calculators are available. There are the links I provided earlier, but there are other links on this page. Going to a landing page where we host the different tools. There's also a blog explaining a bit more about the rationale and how the calculators can be used, that can be shared. And as I said, if you monitor those pages, the landing page particularly, you'll see in a few months additional calculators hopefully being released. So yeah, with this, yeah, thank you for listening, and I'm happy to Alex, happy to take questions.
Thank you very much, Fred. Just a brief message, Fred. I've had some issues with my internet, so in case you don't see me anymore, it's probably because I'd be kicked out. So yes, so we have one question. We have two questions. No, we have one question from Baudouin Standet. Where is your cost effectiveness and budget impact calculation as mentioned in the introduction?
Thank you for the question. So we're not looking at cost effectiveness. Maybe I should have made this clear from the beginning. I mentioned kind of the different some of the considerations for decision making, but the one that we're really tackling with the calculators is only about cost. So we are not at all addressing vaccine impact, where the calculators are not making cost effectiveness calculations. They are not calculating a number of averted cases or disease events. The reason for that, I guess, the purpose of the calculators, of those calculators, is a bit different. For cost effectiveness analysis, there are other tools that are available to do proper cost effectiveness analysis. The thing is that they require much more data, and our objective with those calculators was really to get to cost of the vaccination program with a minimal amount of data entry. For cost effectiveness, one tool I can mention, which does allow for assessing rotavirus vaccines, PCV vaccines, HPV vaccines, and other, is UNIVAC tool that was developed by under the PROVAC initiative by Andrew Clark at the London School of Hygiene and Tropical Medicine. But that's kind of separate and does require much more data to populate and get to a robust analysis. I hope that answers the question.
Thank you. Is there any other question? I don't see any other question in the chat or in the question and answer area. Let me just double check. Okay, thank you.
Maybe Alex, one thing I should mention. So when the calculators were developed, the objective is really to have something that can be picked up directly without any kind of support. However, we do acknowledge that it might be a bit difficult to get started without any kind of orientation. So that's the reason why we kind of, well, that's the objective of this webinar. But I should also mention there's an email address here on the slide that I'm still showing, I guess. And if anyone is interested in using the calculators, but they are facing difficulties, they can always send an email to this to this address, and we will be happy to try and organize the support needed so that the calculators can be used properly. So that would also be your go-to address in case you have other comments or suggestions for improvement or any questions on the calculators.
Thank you. There's another question. So thank you for this detailed presentation. How often do you update prices on the vaccines, and how to reflect specific pricing agreements with industry and Gavi countries?
Yes, that's a very good question. So we've been discussing a bit with Gavi because well, basically most of the default data around the vaccine presentations and their prices are coming from this detailed product profile document that's being released by Gavi, and they tend to update it, I think something like twice a year, unless there are major updates that are required. And so what we've discussed so far is that we would try and follow the same kind of pace of updates. So if Gavi is updating their Gavi detailed product profile documents, and the update is affecting some of the default data in the calculators, then we would update them at that time. And then obviously if there are other factors requiring an update, that's also something we could take care of. The question around prices is a very good one because so for now, what we are showing is really the Gavi price that's being communicated. For countries that are not accessing those prices, for example, non-Gavi countries, they still have the possibility to use the calculators basically by defaulting to 100% the support by defaulting to 100% the share of the vaccine price they're covering and putting 0 for any kind of subsidies. And then they have the possibility to, that's the only cell that's not a yellow shaded cell that's not locked. They can also indicate a different vaccine price. And to get information on vaccine price beyond I guess the Gavi price, we indicate in the instruction tab the WHO vaccine purchase database, which is, I guess, your best source of information when you're not sure about the price that you might be able to access from different manufacturers.
Thank you very much. Thank you, Desiree, for the question. A question from Chantal. You mentioned ongoing discussions about a similar tool for the COVID-19 vaccine. Could you please tell us more about it? Do you think you will be able to release the tool very soon before the low and middle income countries start rollout of the vaccine?
So thank you very much for the question, Chantal. So I mentioned it, I'm not the one involved in those discussions, so it's difficult for me to say when it might be released or if at all it's going to be developed at that point. I think that we are still in discussions with donors about it, and I also know that there are currently tools that are being developed and released. I saw, I think, a tool from WHO released a few weeks ago. So I guess this is really still in discussions around like, would it bring additional value or not, and is it something that's funded? And so I cannot really answer on the timeline, unfortunately.
Thank you. Another question from Desiree again. She's the person who asked the question before.
Yeah.
Anyway, you differentiate on dose compliance and thus increased decreased protection, 2 versus 3 dose?
So we don't, since the tool is not making any calculation around the impact, we are not really accounting for that. The only way we are accounting for difference for 2 versus 3 dose vaccine is that if you select a 2-dose vaccine, the costs are going to be calculated based on 2 doses, and if it's a 3-dose vaccine, the calculator is going to calculate cost based on a 3-dose regimen. So there's really no data around vaccine efficacy or vaccine effectiveness in the tool. Again, if you were using a cost effectiveness model such as the one I mentioned earlier, then that's something that would be accounted for, but not in this calculator.
Thank you. A question from Younes. Nice tool and nice talk. So I understand that the target is Ministry of Finance rather than Ministry of Health. Is it true?
I would say that the target is anyone who's involved in the decision-making process. So that I guess when you have, as part of the decision-making process, you should probably have someone from the Ministry of Finance, someone from the Ministry of Health, people involved in immunization activities, and also, I guess, disease experts and so on. I think when we developed it, what we had in mind is more someone who's sitting within the expanded program and immunization team using it. But I guess the results might be very useful to pitch to the Ministry of Finance, like to provide a rationale regarding why you're selecting one product over another. But I think that the target is not only the Ministry of Finance, that can really be used by other departments.
Thank you, Fred, for this reply. Thank you, Younes, for the question. Another question from Baudouin. Should the cost be calculated as a FIC, a fully immunized child?
I mean, that's not readily available from the tool. That's true. It could be calculated. I think, yeah, we really went to the easiest way to present the cost. So you really see for each year how much is the program going to cost you. If then you want to divide this total cost by the number of fully immunized child, that's perfectly fine, and that's certainly a ratio that's useful, and that's speaking to a number of stakeholders. So yeah, that's definitely something you can do using the calculators. However, the calculation is not readily available.
Thank you, Fred. Another question from Temitayo. Does this calculator accommodate for price freeze commitments as announced by some of the manufacturers? And if you do, how does the figure vary?
That's a very good question. So currently what the calculator is using is the Gavi price as available from their website. And it's true that it's there's no indication, or there's no calculation if this price was to change in the coming year. So so I'd say that currently the calculator is accounting for price freeze commitment, since we're using the same price for the 10-year. But actually, if this price was to change, let's say in 5 years, then well, your calculation would be wrong, basically. That's a very good comment, actually, and something we should think about, how we can make sure the price can be changed across the year if it was to vary.
Thank you very much for the good question and for the reply. We don't have any other questions. So is there any other question that you would like to ask? You can write it in the question and answer area, or you can also write it in the chat room if you want. If you would like to speak, it's also possible. You just need to raise your hand. No other question? Frédéric, is there anything else you would like to add before we close?
No, just thank everyone for attending, and thanks Alex and others that were involved for organizing this webinar.
Thank you very much. So as I said at the very beginning, this webinar is recorded, and we'll share by email the link to the recording as well as the link to the presentation. We'll share again also the email address that you see here in case you have any question or require more information. We thank you.
So I'm afraid we just lost Alex, and he was going to thank everyone for their participation. Yeah, so I'm sorry, Alex, we cannot hear you. Okay, it seems like he dropped. So thanks everyone. I think I'm just gonna be leaving now, and Alex is probably gonna just end the webinar whenever he's able to get back online. So thanks for attending. If you have any additional question, please feel free to reach out. You've seen the email here. You can also write to Alex, and he will be forwarding your question. Thank you so much.